Colorectal cancer is one of the most common cancers in the world, yet it's also one of the most preventable cancers. And so, given that we know what some risk factors are for colon cancer, we know that family history is one of the primary risk factors. And upon diagnosis of a patient with colon cancer, it's important to always think about the possibility that this cancer could have arisen as a result of an inherited predisposition syndrome. Approximately 3 out of every 100 colon cancers diagnosed arise as a result of inherited gene mutations that have tremendous impact on the cancer risk for family members. And it's important to develop systems to identify these patients so that there can be interventions early that will prevent cancers in family members. One of the goals of both Insight as well as the Collaborative Group of the Americas for Inherited Colon Cancer is to educate healthcare providers, physicians, scientists about the features of hereditary cancer syndromes and ways that we can better identify these patients. Nowadays, with advances in genome sequencing, we're identifying more and more patients with genetic predisposition to cancer. And this is a perfect opportunity to be able to use that information to improve their care, both in ways of preventing cancer through screening, through colonoscopy and early identification, as well as for identifying targeted treatments that are more effective in treating patients with these cancers. For example, one of the amazing innovations that was just presented at the recent ASCO meeting in Chicago was the advent of PD-1 inhibitor treatments for microsatellite unstable colorectal cancer patients, particularly for patients with advanced disease who have Lynch syndrome. This is going to be a therapy that's going to completely change the course of treatment and hopefully be able to improve survival in these patients. So we are living in very exciting times with advances in genomic technologies, but still having clinicians be able to talk to patients and elicit the family history is going to be one of the first steps to be able to identify which patients are candidates for genetic evaluation, and hopefully that way be able to identify early individuals that would benefit most from preventive strategies.